How does the present NHS situation impact your work in the community?
Well, recently I've noticed, that the changes have brought about some difficulties for my constituents, and many of them have been contacting me as regards mental health services that are provided locally. With the changes, not everybody is aware of what the changes were, and in fact I think some of them were not communicated. So people found themselves, the ones who were regular users of the mental health services, found themselves without an appointment to see the consultant, and that's where at that point they found out that, I need an appointment, what do I do? And that's when they were realizing, and I have found through extensive research and trying to help my constituents that they have been discharged from the consultancy services to their GPs. So obviously, people need to be informed that this has happened, and it seems to me like majority of people didn't know that this had occurred. So I feel better communication would certainly have helped. So if we are going to transfer mental health patients to the GP, then GPs need some sort of training. And I know the organizations called Mind and Rethink Mental Illness have done some excellent work on it. In fact, I've been part of one of the training in training GPs. I think the outcomes would be much better because at the moment they are general practitioners, they're not necessarily specialists, even though some of them might actually have passion in different directions. So I think something like this would really be very helpful to certainly my constituents in the long run.
What could be done to improve NHS?
I think lots of things could be done. One of my favorite things is that communications. I think we falter with communications between departments, between public, and communications, I think, is the link that's sometimes missing. And I think for me that is actually where we fall down. And I don't mean just language communications, but I mean empathetic communication or between patient and GP, between consultants and patients, and between various departments and in the whole structure. I think because it's for me, NHS is an excellent service, but I think where it breaks down or lets us down is primarily in the communication area.
How does the present NHS situation impact your work and services?
With regards to the overall NHS, pharmacists don't directly have a problem. It's more, I think, hospitals that have the pressure with the way the NHS is going. Where we are impacted is where the NHS is encouraging doctors and pharmacists to reduce the number of admissions to hospitals. There's no other sort of impact directly that the NHS situation affects us. The only other thing is with the cutbacks that go on within the NHS, there are more pressures with doctors and pharmacists with budgets, and so they're constantly restricting what doctors can prescribe, what pharmacists can dispense, put constraints on the way we work in the sense that everybody is constantly watching the budgets. One of the other areas that's been very important this year is where the PCTs have been decommissioned and have now been formed into clinical commissioning groups. One of the problems we're finding as pharmacists is that there's a big gap in communication between the two groups. With the PCTs, we knew who we could talk to. The moment they were decommissioned, if I need to contact somebody in the CCG regarding payments, sometimes I'm having difficulty trying to trace down a person. In terms of payments on services that we've been providing, certain pharmacists haven't got paid since April, simply because of this transition. But we're hoping that this gets sorted out, but 6 months without getting paid for certain services is a very long time. With respect to the way in which we work, it doesn't really affect the way we come across with patients. I've been a pharmacist 30 years, nearly, and I've seen a lot of changes in the NHS, and as each change came, we've had to embrace it and move forward. But at this end of the spectrum, I do find it harder and harder now to cope with the changes.
What do you think could be done to improve NHS?
At the end of the day, it's boiling down to budgets and finance, because that is where the problems are occurring. Services will be deteriorating if there are financial constraints. Then the NHS is bursting at the seams, because we see where doctors are prescribing sometimes very expensive medication. We're very fortunate in this country that we have an NHS, but it can only sustain so much pressure with an increasing population and an aging population.
As a community leader and a patient, what is your experience of National Health Service?
Deteriorated very badly. Used to enjoy the direct contact with the specialist consultants like diabetic consultant, cardiology consultant, psychiatric consultant. We used to have area health authorities and district health authorities that they abolished, and they created primary health centers. Even that they have abolished. Now they are handing over the complete administration of the National Health Service to the GPs. How can the GPs run the health service instead of looking after the patients? So naturally the patients suffer. Prescription charge has gone up to about £9 per year. So more and more money is spent on the administration. One thing we should never ever forget: NHS is there to serve the humanity, to serve the patient. It is not a money-making concern. The way NHS was running about 20-25 years ago, that was okay. So we should go back to that system.
How do the changes in National Health Service impact your work and patient care?
What we are doing now in general practice, and I'm a general practitioner, a family physician, was not what traditionally was happening in the NHS, say 20 years ago. We are dealing with more and more problems in the community and in the primary care, which were traditionally looked upon and dealt with in the secondary care. Things like the management of chronic diseases is now primarily done in the primary care sector. I think we are seeing and will hopefully see even better results as a result of close monitoring of many chronic diseases such as diabetes, high blood pressure, coronary heart disease, asthma, COPD, etc. And this is well documented and evidenced as well. We are also seeing better outcomes of other conditions across the board, and that includes conditions like cancer. The mortality rate from cancers is going down. So there's a lot to celebrate and a lot to acknowledge as well. But this has not come without a price. Obviously, this has resulted in increased workload and increasing demand on the resources. There is more demand for follow-ups. We are seeing more patients which are coming up for follow-up. The diagnostic criteria have changed as well. So the prevalence rates of chronic conditions have gone up. For example, diabetes. And it has been an exponential increase in the diagnostic rate of certain conditions. What was considered to be a normal blood pressure, say 20 years ago, is no longer normal blood pressure. It is an abnormal blood pressure. What was considered as a normal blood sugar 20 years ago is no longer a normal blood sugar. It is a diabetic now. So the goalposts have changed as well. And this is what is really causing an increase in the workload and the demand. In primary care, I think the biggest resources was put under the QOF thing, where GPs were incentivized to look after the chronic diseases better. And we are seeing the results of it. I feel that the chronic disease management has improved, but at the expense of an acute medicine probably. Because GPs and the clinicians are busy dealing with chronic conditions, and hence the time to manage acute cases is less. There are areas where I think probably people need to revisit, because there is sometimes a perverse incentive to make diagnosis and manage things which are not entirely evidence-based. But the government has provided an incentive for the GPs to do it, and hence GPs are doing it. GPs have taken on much more than what was traditionally done in general practice. But I think they are coping better, and the patient surveys is the proof of it. And I can tell you now anecdotally that when I speak to my patients, they would rather be treated in the community and in the practices than in the secondary sector and the hospitals, if possible. I feel that the way the medicine is going, the traditional barrier between primary and secondary care needs to be broken down. And until we start looking at a different model of care, I don't think in the present circumstances this is sustainable in long term.
You have hinted several areas which are either improved or perhaps could be improved. Could you say more about what you think could be improved in National Health Service provisions?
I think I would divide that question under different headings. There are things that needs to be done by the government, there are things that need to be done by the public, and there are things that need to be done by the clinicians. As far as the government is concerned, I think the government needs to be honest and transparent. They need to be open with the public and tell them that this is not a bottomless pit. There are things which are affordable, and there will always be things which may not be affordable. Rationing is not the right term, I think it's prioritization. But they need to acknowledge there is an issue so that people are aware of what can be offered in primary care or in NHS as a general. The other thing which is disrupting NHS most is this pace of change. I'm not against change. Change is a good thing. But the pace of change that is going on, every government comes in and brings in with it its own rules and regulations and tries to dislodge the established organizations and bring in some other organizations, and as it happens, it's the same people running the other organizations with different names. I think this sort of football that the government tries to play, every new party who comes into power does that. That distracts us, and it takes the valuable time from concentrating on the patient care. And I think that is what the government can do to slow down the pace of change. As far as the public is concerned, I think public awareness is very important. And patient education. The way things are going and the number of conditions people are getting. Until people take responsibility for their own health care, I don't think the system can survive. It is our responsibility as well as clinicians to educate the patients. But equally, it's a responsibility from public health, from the government, from everyone concerned, that people are given education. As clinicians, I feel that we need to better educate the patients. We need to work collaboratively. Now, that's where this dichotomy comes. We are getting mixed messages. On one hand, government wants collaboration. On the other hand, you are being paid for what you do. I'm talking about secondary sector. So there's a perverse incentive to over-investigate and over-diagnose in some cases. And the more you do, the more you'll be paid. So on one hand, they're talking about competition, and on the other hand, they will talk about collaboration. At times, there is a conflict between these two, and I think they need to acknowledge it. I think we as clinicians should learn to work better with each other. These artificial barriers that exist between primary and secondary care needs to be broken down. The system should be such that it encourages continuity of patient care. And when I'm talking of continuity, I mean continuity for relationship between the patient, because that is vital, but also informational continuity. We need to have systems whereby if a patient goes to a secondary sector, they can see what is happening or what has happened in the primary care. And similarly, if they have been in a secondary care, then we as GPs can see what was done and not rely on the limited information that is quite often transmitted across the boundaries.
As a leader in the community, what is your experience of National Health Service over the years?
Since I've come to this country, that is 40 years ago, the National Health Service has always been catching the headlines. There hasn't been a day when NHS is not in the news. In this country, every working man and woman pays their taxes, and on top of that we pay national insurance. And we're supposed to get the best health in the world, best health care in the world. What we get is the A&E departments closing down, the doctors oversubscribed, the dentists getting a queue. We have never seen anything better from successive government nor the present government. The cuts, in spite of us paying the taxes, we get cuts, and the service has never been better.
What do you think we could do to improve National Health Service?
In order to improve the National Health Service, we need to get rid of all the hierarchies, the trust, the distrust, and all sort of things they have brought in. It has to be a very simple, very approachable by a common man walking into the general practitioner's surgery or the hospital getting the best treatment. It's a simple thing, and why do we have to create different hierarchies? I fail to understand this. Is it people come in, get the good job, and then create more jobs for themselves and spend the money and then find that it's not working and then scrap that? Millions and millions of pounds have been wasted this way. It could be very simple NHS service. Why can't everybody get access to GPs and hospitals?